Hello everybody and welcome to the Thursday edition of Video Clips. It is spring in Columbus, Ohio, and I'm still wearing long sleeves, but not for long. Not wearing coats every day, that's a good sign, and so we'll be able to go outside and run and participate in outdoor exercise, which brings me to two articles I want to talk about today about exercise. Now, health professionals still promote the idea that health outcomes are largely dependent on genetic predisposition. And I hear this all the time in this office. People will say, I'm diabetic, but that's not surprising because my mother was diabetic or my grandfather was diabetic, or they'll talk about having breast cancer and it runs in the family. Well, evidence doesn't support the idea that genes are the primary cause of disease. And one of the reasons it makes me upset to hear this idea perpetuated is that it turns people into helpless victims. I mean, I don't know about you guys, but I did not get to choose my genes. I'm kind of stuck with them and I got to make the most of the situation. Fortunately, more studies are showing that diet and exercise can override genes and change genetic expression. And a new study in Finland is very interesting because it involved identical twins who participated in similar physical activities as children, but had varying exercise patterns as adults, and they had varying health outcomes too. So research on identical twins is convincing because they have the same DNA, obviously, and they usually grow up in the same household, which means that they share close to identical upbringing. These factors make it easier to look at how something like diet or exercise might impact health outcomes. So for this study, the researchers in Finland drew from from Finland's twin database, which began the collection of data on twin pairs when they were 16, and periodically they continue to gather data as they age. 10 male twin pairs in the study were admitted to the study who were in their mid-20s, and the criteria was that they changed their exercise habits after they left their childhood home. In these pairs, one twin exercised regularly while the other one became more sedentary. Divergence in their exercise patterns had started 3 years before the period of time that was evaluated. The researchers measured things like endurance, body composition, insulin sensitivity, and then determined fitness and metabolic health. The twins were quite different from each other. Sedentary twins had lower endurance, a higher percentage of body fat, and they showed signs of insulin resistance as compared to their identical and more active counterparts, even though their diets had remained very, very similar. The brains of the twin pairs were also different. Active twins had significantly more gray matter than their sedentary siblings, particularly in the areas of the brain governing motor control and coordination. So this study is just another one showing that lifestyle choices like exercise influence markers of health more than genes, and emphasize the fact that genetic predisposition is not genetic destiny. Again, good news, because, as I said, we don't get to choose our genes, but I sure can decide if I'm going to exercise every day, and I sure can decide what I'm going to have for dinner tonight. All right? Now, this next article, also very, very hopeful, because it concerns exercise and Parkinson's disease. Now, Parkinson's disease is a progressive disease of the nervous system. Patients increasingly experience, as the disease progresses, more pronounced tremor, muscular dysfunction, rigidity, and loss of balance and coordination. The disease progression can be pretty rapid, and the quality of life of patients is impaired pretty quickly, but this also places a considerable burden on caregivers and family members as well. So strategies to slow the progression and to keep these people mobile and functional is a gift to the patient and a gift to caregivers. Now, one thing I can tell you is a low-fat, low-protein, plant-based diet can help. One of the reasons is that protein restriction can improve the efficacy of the medications that are used for Parkinson's. But exercise has also been proven to be helpful for Parkinson's patients, and this isn't the first study on this issue that I reported. This particular study shows that exercise improves balance, mobility, fear of falling, and quality of life for PD patients. And patients who had milder forms of the disease experienced fewer falls as the result of exercise. This is important because the more falling causes injury and pain, and in addition to that, it can make patients even more hesitant to move around, and the more sedentary they become, the more disease progression, the more rapidly disease progression can take place. Now, this study included 231 adults with Parkinson's disease who were able to walk at the time the study began. Some of them might have been walking with a walker, some of them not, but they were all mobile. They'd been taking medications for at least 2 weeks, and they'd either fallen one time in the previous year or were determined to be at risk of falling after assessment. And then they were randomized either to a group that got usual care or a group that participated in exercise. The patients in the exercise group were instructed to engage in 40 to 60 minutes of balance and leg strengthening exercises 3 times a week for 6 months. Once a month, they met with a physical therapist and got some instruction, and then the rest of all of this was done on their own at home. Compliance rate was pretty high, by the way. For patients who had milder Parkinson's, there were 69% fewer falls in the exercise group than the group who got usual care. There were more falls in the exercise group for patients with more severe disease, which kind of expected because they would have lost considerable balance and stability as a result of their disease progression. At 6 months, Parkinson's patients participating in exercise scored better than controls on balance and mobility. They had less fear of falling and better mood and quality of life. There aren't any drugs that are being used right now to treat Parkinson's disease that deliver results anything like this. So people with serious diseases like Parkinson's, they visit doctors and they get drugs really early in the disease process. Many of them never look for alternatives, but often the search for alternatives starts when it appears that the drugs really aren't doing much good and they're getting worse anyway. Since those who fared best in this study were patients with milder forms of the disease, which we can assume in many cases means earlier stage, it's apparent that the best time to start introducing exercise diet is immediately after diagnosis, or how about if you don't have Parkinson's disease, do it now so you don't get it. Now, there's no evidence to suggest at this time that patients can eat and exercise their way out of Parkinson's disease like they can type 2 diabetes and some other conditions, but anything that you can do to slow down the progression or stop it for periods of time is an incredible gift to a disease that just sucks the life out of patients and their families. So this is really good news. All right, that's all for today. Have a great one. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you next week with more news.